It is open enrollment season, and health insurance costs are climbing fast for employer-sponsored plans, Medicare, and those who buy coverage on their own through the Affordable Care Act plans. Sharon Epperson is here to tell us how much more you can expect to pay and strategies to manage costs in 2026. Good morning, Sharon.
Good morning, Mike. It's time for people to spend a lot more time turbocharging their savings because health insurance costs are going to go up significantly, impacting companies, workers, and retirees. For the 165 million people who get health insurance through an employer, in 2026, employees could see their payroll deductions for health care premiums rise by 6.5% on average. Medicare covers about 68 million Americans, and Part B premiums pay for the bulk of doctor's visits and outpatient care. The standard monthly Part B premium could go up by 11.6%. And about 24 million Americans rely on Affordable Care Act plans. ACA insurers may raise premiums by about 26% on average next year, but what ACA enrollees pay could be much more. About 22 million ACA participants currently receive a tax credit, and if enhanced tax subsidies are not renewed, their monthly premium payments could double. Now, to manage those rising costs, experts recommend taking these steps before enrolling in a plan. It's tedious, but you want to add up those out-of-pocket costs for this year's, the co-payments, medical bills, prescriptions, and over-the-counter expenses. Tracking what you spent on past healthcare needs will help you figure out potential expenses next year and the type of medical coverage you'll need. Also, check for the doctors that are covered by the plans and the out-of-network coverage. Typically, you're going to have a choice between paying more upfront with higher premiums and a lower deductible, or you can pay a lower premium but have a higher deductible. You also want to take advantage of a health savings account if you can. They're available for health insurance plans with high deductibles, and in 2026, you can make a tax-deductible contribution of up to $4,400 for yourself or $8,750 for your family. The money can be invested, grow tax-free, and when it's used for qualified medical expenses, withdrawals are also tax-free. Now, the HSA option isn't available to Medicare recipients, but starting next year, more ACA plans are going to be HSA eligible. And you'll find a lot more strategies for managing the high costs in my Money 101 newsletter. Sign up with the QR code there or at cnbc.com/money101.
So, Sharon, choosing a plan is always on some level kind of a calculated bet on your own health and what you're going to need down the road. How should that play in with, guess how comprehensive a plan you might want to opt for in the ACA network?
Specifically in the ACA network, you want to make sure that if you're a healthy individual, you at least have a bronze plan so that you're covered for emergencies. That is going to give you the lowest premium. It'll have the higher out-of-pocket expenses and higher deductible. If you have a minor chronic illness, the bronze plan plus something called a direct primary care subscription plan. That is something that one financial advisor recommended, saying that a lot of people who need to see a primary care physician, maybe they have small children or they have something that they need to go regularly for, but not specialists, this can add to that. And then if you have a serious illness, you definitely want to have the most comprehensive care that you can have. That would be the gold plan or the platinum plan.
Right. Then you have to kind of pay up for that coverage.
That.
Yeah. All right, Sharon. Thank you.
Just don't do anything right yet. You want to make sure that if there are any changes, that you're aware of them. So you look at all the plans now, get the sticker shock out of the way, see what you can afford, and then sign up closer to the date that you have to for the January start date, which would be December 15th.